Okay, so I think I'm gonna start the talk now. Welcome everyone. My name is Maria Graciela Cuervo. I'm DON's General Co-Coordinator. I'm a feminist based in the Dominican Republic. I studied law and later specialized in labor policies. And for the past 13 years, I think, I've been working with feminist organizations and international networks for the advancement of human rights, especially women's human rights. And I've been with DON formally for 4 years, but next year is going to be 10 years since I engaged with the organization. I'm very happy about that, obviously. And for those who don't know what DON is a network of feminist scholars, researchers, activists from the Global South who work on economic and gender justice and also on sustainable and democratic development. DON provides a forum for feminist advocacy, research, and analysis. And our intention with these talks is to look at what's going on locally with COVID-19 in the South, to highlight both the gendered impact of the pandemic that has made life harder for everyone, but especially for women and gender non-conforming people, and to critically look at the policies that are taking place locally and nationally to address these hardships. So I'm very happy to be joined today by Vanita Murthy. Vanita is an Indian feminist activist and researcher. She leads the Sexual and Reproductive Health and Rights team in DON. She's an executive member of DON as well. And she's been part of the feminist movement and social movements in Kerala for more than 3 decades now, Vanu. She works with feminist groups and networks in various capacities, including contributing to advocacy, capacity building, and action research. Vanita holds a master's degree in gender studies from the Institute of Social Studies in the Erasmus University and a bachelor degree in biology. So welcome, Vanita. Thank you very much for accepting this invitation. And before we start, I want to give a quick explanation on how the talk will go on, what's the format that we're using. As many of you know, we're using a webinar format, and in this, the participants will not be speaking, especially during the initial part where I will be having this exchange with Vanita. But you are encouraged to use the chat box, and please introduce yourself when you do. Note that in the chat box, you can write to the panelists or to all panelists and attendees. Please use the all panelists and attendees if you want everyone to see your message. And the panelist option if you want only the panelists to see it. We will have a space after the first 50-55 minutes for comments and discussion with you. But if you want to ask concrete questions to Vanita, please put them on the Q&A option. It's next to the chat one, and it's going to be easier so your question doesn't get lost over there. This talk is also being broadcast through DON's Facebook and YouTube pages at DON Feminist if you want to tweet your friends about it. So it will also be available to watch later. It's also on our website with other the other DON talks on COVID-19 that we had over the past 2 months. So I only need to make a very final brief disclaimer. There is a tropical storm alert going on in the Dominican Republic. I'm based in Santo Domingo right now. So I apologize in advance for any weird background noise, or if maybe the communication cuts because of lack of electricity or something like that. I will try to join immediately, but luckily our dear Gita Sen, the other general co-coordinator of DON, will be here to step in if needed. So, without further ado, Vanu.
Vanita.
Anita, I'm so sorry. Yeah, I'm sitting in the Latin American region that has become the new epicenter of the pandemic. Yet India continues to be the number 3 country with more active cases and total cases. I think the total cases are now more than 1.5 million. So can you tell us why are we looking at the Kerala state?
Yeah. So thank you, Maria Gracelia. Good morning, good afternoon, good evening, and warm welcome to all of you who have joined from the various parts of the world. Kerala is just one of the 28 states in India, and it has 35 million people. Now, the very first COVID case broke out in Kerala from Wuhan. Ever since that, I have been watching Kerala very, very closely. And over the last few months, it has stood out, not just in India, but in the world, in the remarkable way it has handled the crisis. I have lived in Kerala for more than 30 years. I mean, I just want to make a correction here. I was a part of the social movements in Kerala for a brief period when I was there. I've since moved to Delhi. And I moved to Kerala when I was a very young woman. And one of my very early lessons in Kerala was on rights. And I'd like to open with a very small story that is so insightful of what Kerala is. So our domestic worker was deserted by her husband with a small son. She was fighting for alimony from her husband in the court. She was literate, but she had not studied beyond the primary school. She had no lawyer to represent her. She represented herself. The only help she got was from a court clerk. I watched her journey closely as a young woman, and what was most astounding was that she got her alimony in the end and won the case. And not just that, whenever he defaulted her, she managed to put him into custody. Now, this story is all about for me, it just showed the acute awareness of a domestic worker with just primary school education about her rights and entitlement from the system and the state. She was most inspiring for me, and I felt a complete ignoramus in front of her because she had a very detailed knowledge on the way to claim maintenance, and she was very savvy in the steps she needed to take. She knew every step of the way. And this was just one of the many lessons that I got on rights in Kerala. So Kerala, I'm telling this story because Kerala has a very long history and legacy of claiming rights from the state. More than 100 years ago, one of the very low caste groups fought for education and employment. It was not about temple entry, but the temples of education were their goal. And after that, you see a long history where there are so many social movements of all hues and shades that have thrived for more than a century. It's also a place where the civil society is extraordinarily vibrant. And if you live in Kerala, there'll not be a day without which there won't be a protest, a march, a sit-in, and all for rights, which is so much an integral part of the political fabric. Now, the other thing is that Kerala's labor is also highly unionized. They have the highest wage rates in the country. They have the best working condition with social security and very special rights. And some rights are unheard of elsewhere in the world. So the social contract between the state and the citizen is built on a strong foundation of rights. I think the only enduring paradox in this story is when it comes to women's rights, and we'll speak about it later. I also want to tell you that Kerala is led by a coalition of the Left Democratic Front, and the leader of this coalition is the Communist Party of India, Marxist, CPM for short. So when COVID-19 spread in the country, and the more we got to know about is the challenging nature of this epidemic and the multiple crises it brought in its wake, the big question for me was, can a state deal with a challenging pandemic and balance the rights of its citizen? So given the history and legacy of rights, I thought Kerala would be a very good test case to see how the state responds to it. And that's why the focus on Kerala.
Thank you, Vanita. Yes, we have definitely heard as well how Kerala, in the response to COVID, has become like the success story. And there is a hype about it, about the Kerala model. How the state is managing this health crisis with 35 million people. Where's the balance in the state performance around this?
You know, there are many, many pieces and elements in the managing of this health crisis. And the more I read and the more conversations that I've had, admittedly with a very small cross-section of people working on the ground in Kerala, for me, what stands out most powerfully is both the policies and the implementation of the programs. And as I analyzed each one of them, what struck me deeply is that they are based on principles of equality and justice. So even during a crisis, Kerala works on principles of equality and justice. So now these are very lofty words. And I think we need to really unpack that a bit and try and understand in what ways does it pan out. And the most powerful piece through this crisis was its commitment to substantive equality for all socially disadvantaged populations. Now, those who are listening in, all and mostly feminists and women's rights activists, are extremely familiar with this concept of substantive equality. Now, for those who are not familiar with this concept, I just want to dwell on it a bit because I think this is critical to understand all Kerala's interventions in a deeper way. And you know, we are all familiar with what's called formal equality. That is when the state frames laws and policy with equality as a goal. And there is an assumption that it will have an equal impact on everyone and will provide equal opportunity to all. Now, with all good intentions of the state, the laws, the policies, the programs, actually, when they translate, do not translate into equal treatment or opportunity for all and for all its citizens. And why? Because the social divides and inequalities in India are so deep, and they're based on very differential positions of hierarchy of class, caste, gender, ethnicity, religion, ability, sexual identity, age, and so on, that just a formal equality really doesn't help. So for a genuine equality to kick in and take shape, the state has to move beyond providing equal treatment and opportunity to proactively ensure that the barriers to leverage these opportunities are also addressed and that steps are taken in that direction. So it's about removing barriers and also taking steps. Now, I was fascinated when I kept reading about Kerala, and you know, there is so much of material on Kerala now from all over. I found that there are many, many examples from Kerala on substantive equality, and I will actually illustrate them as we go on in this conversation. But for me, the larger question was, how did Kerala deliver on this substantive equality? And what was some of the social and physical infrastructure that it needed to have in place to deliver this? And you know, the more I delved into it and the more I heard people talk on Kerala, I think the star of the Kerala model in the times of COVID is decentralization. And I want to underline it very clearly here. So there's a decentralization of governance at the grassroots, and there's also a fairly decentralized public health system in Kerala. Now, this again was put in place by the Left Democratic Front led by the CPM. Now, CPM is the only democratically elected left government in the world. If you traveled on the highways of Kerala, even 10 years ago, you would find the CPM Congress advertising its event with huge posters of Marx, Lenin, and Stalin. I'm not sure if those posters continue anymore. But also, what was more interesting for me in my field work, I've come across a pair of twins called Lenin and Stalin. Now, once upon a time, Stalin was an icon in Kerala, and you know, the Marxist party subscribed, or perhaps still subscribes, to democratic centralism. Yet, when the same LDF came to power in 1996, it has institutionalized one of the most path-breaking and bold form of democratic governance through decentralization at the grassroots in the panchayat system of India. Now, the panchayats also need some explanations because we have an international audience here. Now, these are local self-governance institutions that have been brought in through a constitutional amendment. It's basically a 3-tier system of local governance. You see, every state in India is divided into administrative units called districts. And this was the last frontier of decentralization before the panchayats. What happened with the panchayats is they started going lower and lower right up to the village level. So all panchayats, including in the villages, they're democratically elected bodies with reservations for women, 50% reservation, scheduled caste and tribes, who are the socially disadvantaged groups in India. So now, for those who are not from India, I'll quickly say what caste is. It's a very egregious form of social discrimination based on occupational hierarchy. It's determined by birth and it is sanctioned by Hindu religion. So there are strict rules and norms, and it's based on an idea of purity and pollution. It's too complex to give a whole treatise on caste, but basically to say that it's caste that decides your opportunity in India as much as, you know, your other social status. Now, Kerala, coming back to the decentralized governance, what the left front did 25 years ago was devolve power not just to the villages to govern themselves, but also devolve financial resources to back them up. And this is important. Up to 35% of the state budgets go to these local bodies. In 1996, there was a women's component plan of 10%, but I think now it's no more there, and perhaps it's mainstreamed, I'm not sure. But more important, there are also what's called untied funds, you know, that are not pre-designated by government schemes, which gives money to the panchayats to allocate resources based on the priorities of the people on the ground. So what Kerala did was it went on a campaign mode of what's called the People's Plan campaign. So if you can imagine a town hall meeting, panchayats are kind of similar to that, where people come from the villages. I mean, of course, it's not very ideal. It operates with a lot of ups and downs. And there are more than 1,000 panchayats. And the most important thing to note here was that it is these panchayats who actually administer the health and a whole lot of government departments, including the health and education, okay? And also most of the social justice program and social welfare programs are also managed by the panchayats. And one of the, I just want to give a quick example of the Rights of People with Disabilities Act. In my whole search on COVID, I found that every disabled person living in the village, there is data on them, there's data on the type of disability, including mental health issues, and there are a slew of support and benefits provided by the state, including education, skills building, aid, prosthetics, etc. And also, it's sort of tailored to the needs of each one. And every building after this act has to be disabled friendly. Now, the panchayats also have a 4.5 million strong network of membership groups called neighborhood groups called Kudumbashree. Now, this is like, I would call it a government NGO, a gongo. And you know, it's like they are working very, very closely with the panchayats, and there are more than 300,000 NHGs and more than 4.5 million women members into neighborhood groups. And there are neighborhood groups there's a lot of diversity here for the elderly, transgenders, and for women with disabilities. So this is the broad architecture of decentralized governance that we need to understand when we begin to understand COVID interventions in Kerala. So one of the things that they demonstrated, the panchayats, when there was a flood, is those who are nearest to the people and the situation are best suited to solve their problems. So even though the revenue department of Kerala was in charge of floods, they just took over and delivered. Now, coming back to the health issue, so Kerala was actually prepared because they have faced floods, they've faced the Nipah virus, and therefore they set up what's called a Corona Control Room, which was a 24/7 with 18 task forces. And the last mile and the last person was reached out by the panchayats. Now, I see there are two distinct phases in the journey of COVID-19 in Kerala. The first phase was when Kerala managed to flatten the curve in 3 months by April. In the second phase, that is just begun, there's community transmission. And it so happens that Kerala is the only state to declare this. So there must be other states in India with this transmission. So to give a perspective on where Kerala is with regard to COVID, like Maria Graciela mentioned, there are 1.5 million cases in India. Now, Kerala was leading the country on March 31st with 231 cases. Just next in the rank was Maharashtra state, below it on the second rank with 220 cases. 4 months later, we are in July 30th now, Maharashtra continues to be number one with 400,461 cases, and Kerala is in the 16th rank from the first rank to 21,000 cases. And I think the most important thing to note here is that the case fatality rates are one of the lowest in India, which is anywhere between 0.38 to 5.8, I was not sure. And all this is happening with more than 500,000 overseas migrants. More than 600,000 overseas migrants have returned back home to Kerala from overseas in the last 2 months. So, you know, that's how even the thing has spread, the virus. Our second star in the Kerala story is the public health system. Currently, the public health system is very robust, and it has been strengthened recently by sustained investments, and this has been happening for the last 15 years. Now, there was a point in time in Kerala after the financial crisis in 1970 or so, where the allocation for public health went down drastically and private hospitals took over. And so there was a large-scale privatization of healthcare. But in the COVID-19 care, private health system is invisible, not just in India, but also in Kerala. Now, what the decentralization of healthcare has done, it has entrenched the right to health in Kerala in a very fundamental way. Not only is healthcare universal, it's highly accessible and affordable because largely there are free consultations and medicines for those who cannot afford. And it is managed by the panchayats with community participation. So it's, you know, it also takes care of all the underlying determinants of health like water, sanitation, lifestyles. And because it is based at the very local level, there's a lot of transparency and accountability and checks and balances that make it quite non-discriminatory. So far in the current term, the LDF government has invested $31 million in the health system. I think it's something in the Indian money, it converts to 2,266 crores. Now, their target is $55 million in their political term. And this is being done in a mission mode called Ardram. I hope I'm pronouncing it correctly. In Malayalam, it has a meaning which is idiomatic of being empathetic, about being kind and sensitive. And it is done in a mission mode. And the goal of Ardram is to treat everyone with dignity. Whoever comes to the public healthcare system will be treated with dignity. So Ardram did was to convert the primary health care centers into family health centers that serve about 30,000 population and provide 24-hour treatment for a range of specialization, which include OB and GNY, oncology, cardiology, nephrology. So we're talking about a primary healthcare with specialization and mental health counseling. A whole lot of professionals, more than 5,000 were appointed. Okay, so this is the background. Now, coming back to COVID, every single case in Kerala of COVID is tested and treated at the expense of the state. So they started a campaign on COVID called the Break the Chain. And very early on, systems for testing, contact tracing, route mapping, and quarantine was put in place. The surveillance in Kerala for contact tracing has been manual, in contrast to the tech-based surveillance employed in some other countries. There are more than 250,000 volunteers who work as virus detectives, and they track people who are on the virus routes. For people in quarantine and isolation, and I think there are hundreds of thousands of people who have gone through this in Kerala at the cost of the state, there are mental health interventions and distance counseling. Plus, there are specially designated COVID treatment hospitals in every district. And this month, with the spread of community transmission, the separate COVID first-line treatment centers have been put in place at the panchayats. So even COVID treatment has now been decentralized. And in the last 10 days, more than 140 first-line treatment centers have been started across the panchayats wherever there's intensification of the infection. Now, the pool of doctors and nurses were expanded on an emergency basis, and salaries for frontline workers were enhanced during this period. And this is important to note because they play a very critical role. And there were special guidelines that were introduced for treating pregnancy and childbirths and tuberculosis patients and those who were dependent on alcohol. And what was most interesting for me was the protocols for the healthcare personnel and what they called was a scientific management of their duty roster. In Delhi, doctors wear a PPE suit and are dying and suffering for 8 to 12 hours. Guess what? In Kerala, they don't wear it for more than 4 hours. They get a break from their PPE suit within 4 hours. And you know, even the roster of their duty. So if a doctor does a 1 week COVID duty, for the next 2 weeks, he's on other duties. And then he comes back in the 3rd week. So they have a very nice rotation to rest doctors from this very intensive work. So also there's a contingency plan put in place to convert some of the private health facility into COVID hospitals. Currently, I mean, Kerala is trying to be dependent on state facilities, but when, you know, they just cannot, they're going to sort of send people into private sector. And unlike other states, and especially Delhi that I can compare to, the state is in very hard negotiation with the private sector on the treatment charges. I just want to contrast this with Delhi, where private hospitals have been charging runaway anywhere between 20,000 to 30,000 US dollars for treatment of COVID for 21 days. Now, in all this scenario, what also stands out is a certain level of transparency and flow of information. The Chief Minister of Kerala and the Health Minister, who's a woman, her name is K.K. Shailaja. She's very well known as Shailaja teacher, and I think has become quite a star in the world for all her work that she's done. They put out regular information and bulletins. The Chief Minister addresses people every evening, updating them on what's happening and the steps taken by the state. And this is basically to ward off fake news, you know, because in these situations, always fake news flourish. And they have floated a government WhatsApp with very reliable information. So, you know, people are not swayed with all this, all kinds of information. Now, even with all this transparency, there is fear about the virus. And the fear has resulted in stigma of those infected. Now, elsewhere in the country, stigma is associated with religious groups, with, you know, people who look like Chinese. But in Kerala, the stigma is associated with the infection. People are just scared of getting the infection. So there have been instances of shops selling goods and deliver in containment zone. And this is leading to some level of discrimination. And I think it's one of those difficult issues to sort out. And also the fear of virus has resulted in many people avoiding to go to the hospitals unless it's absolutely essential. So I'll stop at there. And Maria Graciela.
Yeah, this has been so interesting and important to understand how come it's doing so well. I mean, organizations like ours have been advocating for strengthening public systems for long time, and actually fighting international financial institutions' recommendations for privatization and austerity policies. And in Kerala, we see why this importance. And we also see this model of decentralization of governance at the grassroots, how it really provides a distribution of power and a real democratic governance all in all. I want to pause briefly before I continue with my next question to acknowledge the presence of Mr. Thomas Isaac, who's the finance minister in Kerala. Mr. Isaac, it's a pleasure to have you here, and please feel free to comment at any point in the chat box, or we can also give you the word at the end, so you have a few minutes to make whatever comment you would like to. Also, we have very special and dear people and activists from Kerala that are joining us today, including Miridu Ipen and Nalini Nayak.
And Eliama and Meera. I'm going to mention them because I know them. Meera Velayudan. I mean, there are a bunch of them. I'm sorry. I mean, I saw Meera, I saw Eliama, I saw Nalini, I saw Mridul and Isaac. Thank you so much for joining in.
Yeah, and I'm sure we're missing many others that might be there in this long list.
Yeah.
Yes, thank you so much all for being here, and please do intervene in the chat box wherever you need necessary. So now, going back to understanding this amazing work that is being done in Kerala, but also contextualizing it in India, because there have been federal policies that the country has taken that the state of Kerala has to take as well. Including the most stringent lockdown in the world, or one of them, perhaps. Everything went standstill and disrupted the life of 1.3 billion people. So how did Kerala handle this? Because the lockdowns were applied as well in Kerala, right?
Yeah. So Kerala is a part of India. As I said, it's a state, it's not a country. So it has to follow all the regulation and the rules and everything that is put in place by the federal government in Delhi. So let me give a little background. Now, for the lockdown, two extraordinary measures, and even for the COVID, are in operation in the country and in all the states, and that's a Disaster Management Act of 2005 was invoked, and the Epidemic Diseases Ordinance Act was passed. And this is one of the acts that was amended. Now, these measures give extraordinary power to the state to take care of emergency situations in the name of public good to protect its citizens. The control, I mean, there's a lot of control and discipline of people in the process, and it's largely entrusted to the law enforcement machinery in India, basically the police. And any contravention, there are serious penalties for violation, and some of them are actually cognizable and non-bailable offense, which is a police can arrest you if he thinks you're not wearing a mask, for example. I mean, I'm exaggerating, without a warrant, and he doesn't even have to go to court. So basically, these have become potential instruments of biopower for the state to manage. And I'm not an expert on Foucault, but I'm using the biopower because in Dawn, we have been talking a lot about biopower and biopolitics. And I think these acts, and especially the Epidemic Diseases Ordinance, is a biopower to manage and discipline and control entire populations, 1.3 billion en masse, by controlling their movement and their behavior, by preventing gathering, freedom of assembly, by notifying lockdown, subjecting people to quarantine, and designating containment zone. So the key question for emergency measures is, especially in a democracy, even if they are justified in the name of a public good, are they proportional? Are they legal and subject to the rule of law? And are they non-discriminatory? And I think we need to really examine this for India and for Kerala. I mean, India is a very sordid story. So, and I think all of you know that when there was a complete lockdown in place with 4 hours notice by the government of India, there was chaos, confusion, disruptions where work, livelihoods, and everything came to a standstill. And this lockdown has really exposed the serious fault lines and the very, very high level of inequalities in the country. And predictably, these impact of these emergency measures are very different, for different groups of people. And they're largely negative for all the non-privileged and the disadvantaged sections of the population of India. Now, in Kerala, to address the negative impacts of the lockdown, the first thing that the government did was to announce a comprehensive social protection package. And the allocation for a small state was $270 million US. It was a comprehensive relief package to avert a humanitarian crisis in the wake of a lockdown. What it did was it included government food provisioning on a very large scale. It doubled allocations for a rural job guarantee scheme. It advanced 2 months pension payment for the elderly. It allocated $27 million, 10% of the package, for interest-free consumer loans for women, for mental health helplines, and a waiver of interest on debt payments. And these were all channeled to the Kudumbasri neighborhood groups. There are 5.5 million wage workers who are members of welfare board. They received financial support. During the lockdown, Kerala got the internet service providers to boost capacity to meet demands of the new work from home routine. There was waiver of electricity bill for the first month, waiver of water bills also, I think. And they made a call for volunteers, and more than 350,000 registered as volunteers, and they formed a backbone for a slew of intervention by the state through the panchayats. Now, I think the most interesting thing for me about Kerala as I was reading was, in stark contrast to what was happening in some countries of Europe, where there was a severe stress on health infrastructure that began to reflect a neo-Darwinism through natural selection and survival of the fittest on who should live and who should die. I mean, health systems were making this choice, you know, and especially for the elderly. In Kerala, the elderly are protected by the state through what's called a reverse quarantine method, where all elderly people above the age of 65 are encouraged to stay within the boundaries of their home. The state provides all the necessary care and support and infrastructure at their doorstep. There are dedicated volunteers to take care of the elderly who visit them, take care of their needs, including food if they require. They are also connected to doctors through telemedicine services. If the need arises, they're given all their medications at hand. And there is also mental health counseling and games that is a part of the elderly care. So this is, I think, something quite unique. And I think the idea behind that is that those who are vulnerable should be protected. And, you know, even pregnant women are classified as vulnerable among them. I just want to bring, as a part of this whole substantive equality, examples of two issues, which is right to food and right to education in Kerala. In the right to food, the first thing that the chief minister declared in his TV address was, no one will starve and no one will sleep hungry in the state. And he was serious about it, because in the first month, universal food kits covering 97% of the population, and remember there are 35 million people here, were given to include not just cereals, pulses, sugar, tea, oil and spices, but also soap. And I think in some instances, sanitary pads as well. Now, what is most remarkable about this universal coverage is that the last mile and the last family was covered. You know, there were stories about government officials carrying food kits, traveling on foot, wading through water in very difficult terrains to interior forested area where the tribals live. In one remote tribal pocket, only 6 families live. And they had to travel 6-7 kilometers on foot, but they received their food kits. There were more than 2,000 community kitchens that were opened to provide food. Half of them were free, of course, for those who could not afford them, and they were given especially to migrant workers. The rest of them, you know, and for those who could afford to pay, paid them at a very nominal price of $25. 25 cents. What am I saying? 20 rupees. So it was fully funded by the panchayats, and there was free contribution of labor by the women. So this was the large universal care. And one of our leading journalists called Sainath calls it the food justice of Kerala. Because not only was this there, you know, we have these what's called Anganwadi daycare centers where children go, below 5 go. And these are normally from very disadvantaged families. And they get a meal every afternoon, and so do some children in school. So Kerala actually saw to it that every child who's a part of Anganwadi, and there are 2.6 million of them, got their food kits at the doorstep. All quarantine camps have free food. All homeless and destitutes were covered. And for me, the most interesting was there was food justice for animals. Temple elephants, stray dogs, monkeys were also not neglected while there were, starving migrants walking for miles without food, without any care, which we saw in the rest of India. Now, so this is what I think is an extraordinary example of substantive equality, where the state really saw all the populations, all the barriers, and addressed them. The second right is the right to education. Now, the lockdown and online schools have exposed a deep, deep digital divide in India. There are many stories in northern parts of India of how parents are selling their cows, they're selling their meager asset just to buy a smartphone for a child to continue education. In a city like Bombay, just 2 days ago, there are stories of young girls who are in schools are discontinuing education and working as domestic workers. And because they're so poor, they don't have any wherewithal to buy a smartphone. Now, in Kerala, there were some hiccups to begin with on the right to education. They had prepared a list of students without access to smartphone or televisions, and these were prepared at the local level. The idea was to provide one television by the state to every local community libraries and create neighborhood community centers for a group of 10 or very small groups with distancing norms. And for students who couldn't make it to the libraries due to distance and access issue, smartphones would be provided by the state. And they also had what was called a TV program called The First Bell. It was by television, and it was streamed free. However, before all this was put into place, I think the state did a mistake of starting the classes. So some of them fell through the cracks, and there's a sad story of a tribal girl who committed suicide because her TV was not functioning at home. But in 2 weeks, this was the only story we heard. In 2 weeks, all the infrastructure issues, everything was sorted out, and now there's a near full coverage of students. In one instance, a migrant's family had no electricity. They'd given her TV. Even this was brought to the notice of the local councillor, and the family got electricity connection for the first bell classes. In Kerala, the High Court has restrained schools from levying additional school fees during the lockdown, citing the Right to Children's Free and Compulsory Education Act of 2009. So, so basically, if you see at health, food, and the right to education, you can see extremely interesting examples of substantive equality by the state in action. And I think what's also important to mention here, because we're talking about digital divide and digital justice, Kerala will be the first state in the country to provide a high-speed internet to the less privileged sections of the state through a Kerala fiber optic network. It's called KFON. And that will happen by the end of the year, and it will provide a blanket coverage to the whole state and free internet services to 2 million poor households. That is, if the financial resources permit, given that a lot of money has gone into dealing with the COVID crisis.
Thank you, Anita. Yeah, I think it's especially interesting to explain exactly how the equality principle that you mentioned at the beginning work. And one of the ways is looking at the needs of particular populations. You also mentioned the contribution of women. So I want to, from there, ask you how did gender issues play out in Kerala, or are playing out during the pandemic?
Yeah. So the gender paradox in Kerala continues perennially. I mean, there is high literacy, access to healthcare, high human development indicators, but very low female labor force participation, and the prevalence of domestic violence. Now, political participation is crowded at the grassroots, but if you look at their legislature, there are only 5.7% out of 140 members. If I'm not mistaken, there are 8 members. Now, to add further to this paradox, this is a state that had matriliny, matrilocality, and men moved with women, and women inherited property. So I think these are the paradox that we need to keep in mind. And I mean, this has been researched forever, but I mean, there are analyses, but it's too complex a story. So basically, I want to focus on a few things, and that is, one is maternal health, one is transgender, and look at briefly the domestic violence and care work. So, as I said, pregnancy and delivery was actually seen as an essential service, and women who were pregnant were seen as vulnerable. So right from the first line treatment center, like there's a special ward for pregnant women who have been positive, and they have a separate quarantine and nutritious food. Private hospitals in Kerala are refusing to admit pregnant women who are COVID positive. So there's a huge reverse flow for pregnancy to public hospitals. So not only I mean, I had this very interesting story that Eliama shared with me, and I want to share it here, which was that, you know, it's not only that the state ensures substantive equality, but there is a kind of culture of substantive equality that is seeped in the state, where individual government officials are taking decisions. For example, there's a pregnant woman with a spotting who went to the doctor, and he asked her, why are you spotting? And she said, you know, I climb up and down the hill to carry water. I mean, all her domestic chores. And then he said, okay. And, you know, she came back home, and the next thing she finds is there was a fire engine in front of her house filling water in her tank. So what he had done is he had alerted the government officials that here's a pregnant woman who cannot afford to go, and that we should help her. So, you know, these are the little stories that have emerged, and there are many such stories about action on the ground. So, and this is again in contrast to Delhi, where a woman died because she was kicked around from one hospital to the other in her labor pains to 8 hospitals, and she died. Now, Kerala also has a very progressive transgender policy with district and state level resource centers, and they also enjoy a whole lot of rights, but of course, implementation is another thing. But by and large, I think it is a mixed story, and they have resource groups, they have special schools, residential school for transgenders. The social department has, Justice Department has reallocated 4 transgender centers in Kerala. I mean, there's a lot that's happening. In the context of COVID, they were being kicked out of their homes during lockdown, you know, because they couldn't pay the rent, and they got shelter and food from the state. I'll also touch upon violence against women. I think I'm running out of time, but so quickly, there is you know, it has gone up. I mean, there are lots of data sources in Kerala, the State Commission on Women, and there are so many helplines. And the best part was this chief minister warned the men of Kerala that lockdown should not end by you being in the lockup, and warning that any man who beats his wife will end up in the lockup with fines and with time in the jail. But the interesting part is, in the counseling centers, whenever women call, they do not want to file a case because they do not want to send their husbands to jail. They're saying, please do some other way and warn our husbands. We don't want our husbands to be in jail. So that's another very interesting insight for me. The other thing is with men at home, there is a lot of paranoia. You know, this is something very peculiar, and lots of psychologists have talked about. Somehow there's a suspicion about men that, you know, their wives are having affairs. So they're constantly checking mobiles, their cells. So actually, even complaining about the violence has been a problem, but they have used WhatsApp, and the police records show that, you know, the cases are less because they cannot reach the police station. So now there are, I think, the ASHA workers who are going home are sometimes collecting these stories of violence and helping out. So also women talk about, you know, that work at home has increased to 20 hours because children are making demands. Husbands want to eat special food, tea, snacks, lunch. I mean, the usual story. And in one of his addresses, the chief minister also exhorted the men to help them in the household work. That has not happened, but it reminds me of Fidel Castro. In Cuba, Castro had made it a law for sharing of domestic work and said any man who faults can be taken to task and a case can be filed. Of course, no cases were filed, but I think this is one of the most, it's a frontier of gender revolution. And if Kerala can show it in some way, you know, by breaking through this, it would be a big advance. I think the last thing I want to talk about is the army of frontline health workers. And, you know, the one thing that has been critiqued is they're doing fantastic work, but they are the most in demand. And there's a lot of their labor that's being taken for granted. And they're working, I mean, Kudumbashree is a government NGO, it's a gongo, so they work on a voluntary. So there are lots of issues about burdening women. And, you know, even if ASHA workers are paid an extra honorarium, they are doing all the leg work, even the Anganwadi workers of, you know, all this surveillance, quarantining, taking care of old people, all the care and nurture have also now extended to elderly. So that is the story of gender in Kerala during COVID.
Okay, thank you, Vanita. The way I see it, we obviously still have enormous challenges in terms of gender discrimination. But what you said about having a state that is trying to push frontiers along with civil society and the feminist movement, it's already a big step. And not only that, they are also taking some measures to also attack gender disparities and inequalities. There's another group of people, let's say, that have been especially impacted with the pandemic, and especially in India. I'm talking about the internal migrants. And we saw at the beginning of the pandemic, and as part of one of the first measures that the Indian government took, was the implications to internal migrants and the exodus of millions of migrants going back to their villages. And the way it was handled was inadequate, to say the least. And it was very shocking for people like me sitting in Santo Domingo, looking at those images of people walking back to their country, to their villages, under extremely harsh conditions. They were maimed, others died on the way. So what happened in Kerala with the migrant workers? Because then again, this was another of those federal policies that took place.
Well, you know, Kerala has 3.5 million migrant workers, and they come from the east and north of India. And it's a fairly recent, I think it's about 15 to 20 years old. Now, some of the migrants workers who are a part of the construction sector are made a part of the workers cooperative, but you know, it's a mixed picture. Not everyone is covered. Even though the state is trying, there are many migrant workers who do not enjoy all the social security benefits like, say, the cooperative members do. And they are called guest workers in Kerala. And you know, it was done basically for inclusion so that they're not seen as someone alien. But there's a lot of critique about that as well by some academics who say by calling them guest workers, it's a form of inclusion because you're not recognizing them as citizens, and that they should be called migrant workers. So, but I think the most important thing is what happened in Kerala. It was astounding. And I know I have only wonderful stories to say at this moment and not the critiques. But about 300,000 were put up in more than 19,000 camps where food, medicine, and health checkups were given. They got complimentary mobile talk time to reach out to their families. They got entertainment and games for leisure. There was psychosocial counseling in 5 different languages, their mother tongue, so that, you know, they do not go through any mental health problems. For me, this is another example of substantive equality. And each camp was monitored on a daily basis. And I think the Chief Minister took very special care in terms of really tracking the welfare of the migrant workers. And I just heard a story that while these Delhi, migrants from Delhi were trudging without food and at a huge cost. The Kerala migrant workers were asking for extra chicken in their biryani. So, I mean, this is the sense of entitlement that the state gives. And yeah, I think I'll stop there because of lack of time.
We'll have a bit of time later, so if you want to expand on that and maybe respond in one of the questions, but I do want to use the little bit of time we have left for my questions to ask you something about, the history of Kerala government being from the left. And the way you contextualize this at the beginning, this also has a lot to do with the way in which, where they come from on their policies and their principles. If we see at Vietnam, for example, that is also a communist-led government. And it's also seen as success in handling the COVID-19 crisis. It is critiqued, though, for its heavy hand control in managing the pandemic. Would you say that Kerala, that comes from a similar community party tradition, it's different and in the way that they have approached the responding to the pandemic?
There are some similarities. I have just read an article on Vietnam. I think what's similar is the preparedness. They dealt with SARS and MERS, and Kerala dealt with Nipah virus and the floods. Okay, so they were quite prepared. The second is this, how they can mobilize volunteers in hundreds of thousands or thousands in Vietnam for testing, tracking, quarantining, without using the electronic surveillance. But I think the big difference between the two, and if we assess them, Vietnam is just a one-party country without democracy. To Kerala's credit, they were bold enough to experiment with democratic decentralization. And I think that makes a big difference to the COVID-19 experience. Plus, Kerala is a multi-party democracy in India, and there are a whole lot of political pressures that the state faces. For example, the opposition parties in Kerala today, they were very cooperative in the beginning, the Congress party, and there's a right-wing BJP there. I don't know if they were cooperative, but the Congress was in the beginning. And then when they saw this success and the way this government was getting popular and elections was 9 months away, over the last month, they have become vicious, completely vicious, using slander, using sleaze, and all kinds of scandals to pin down the ruling party during a pandemic. I mean, they're just absolutely irresponsible behavior. Then also the Kerala state has to contend with the central leadership in Delhi, who hold the purse strings. There's an unprecedented fiscal crisis that the state is facing. The state's revenue has shrunk dramatically because, it's lockdown and they're not collecting sufficient resources. But this has not deterred the state from rolling out such a big package of social protection and really taking care of its people. And I think the finance minister is here, so he can tell us in the way he has done it. I think I want to stop here, and I want to thank everyone for being here. And I know I have painted a very rosy picture, but I tried to put on a very critical lens. Yet for me, every story was more heartening than the other. And what I would request is my friends from Kerala to put on their critical lens and talk about, what didn't go well. So I would stop here and request, I think we can request Isaac, and thank you again, Isaac, for being here.
Yes, and may I'm sorry, I'm going to take this opportunity having Mr. Isaac here, just also maybe he could address one of the questions that were made by the public. Susie Jolie asked earlier, it's fantastic to hear these inspiring stories. It sounds like resources are rationally allocated. to clinics at local level, supporting healthcare workers' salaries, etc. Where do the resources come from? It might cost less to the state in the longer run, but where do they get the money? Progressive taxes at state level? So if the minister can address that question, that will be great. I cannot think of anyone better to do so. Thank you.
So Vanida.
Yes.
Yeah, please go ahead.
On the spot like that. Welcome and thank you so much.
Yeah, welcome, Isaac. Thank you for joining in.
Vanida, when I heard of your topic, I was wondering the title, because all pandemics, disasters, are times when all rights are taken away. The disaster management authority, they take away all the rights.
Yeah, exactly.
And that's why thinking today among the social political thinkers, that the pandemics may promote authoritarian trends in the world and so on, which is also correct to an extent. Therefore, when you think about a rights-based approach to control, address the COVID problem, that is a very interesting way of conceptualizing the problem, the challenge. And I was very happy when you said the first actor in this drama is the local governments, the decentralization in Kerala. In fact, just yesterday, finished a paper for Aruna Roy edited volume a few days back. The title is Rights-Based Development and Democratic Decentralization in Kerala. Now, in fact, the development process in Kerala has been dominated by a rights-based approach. If Kerala, Vanida has, in fact, very briefly summarized Kerala's development process, though it is a relatively economically backward or poor state or region, in terms of social sector achievements, is far above the national average. So that ordinary citizens in Kerala, even the poor, are assured of certain basic needs, education, healthcare, housing, and so on, certain basic rights. Now there are a large number of studies which have examined how this came about, what created this new Kerala. And now the dominant thinking which is widely accepted is a demand-led development, demand from below. Social movements and political parties and agitated for healthcare, for education, for housing, for land, better wages, made demand. And because they thought it was the right, education is the right. The first strike in Kerala history at the end of 19th century was led by the lowest caste system, with the lowest caste, the agricultural serf laborers at the time, demanding not say higher wages and so on. You know what the demand was? Right to go to public schools. Okay, that was the first strike in Kerala. So it is this demand from below for basic rights of any human being, including civil rights. The successive governments have been forced to respond to, because there were such social pressures that were being generated. And Kerala evolved into what it is today. And then, about 25 years back, some of us thought, given the constitutional changes that were taking place in India, why don't we take it to a higher level, this rights-based development? Now people make demand on the government. Okay, this is all right, education, healthcare, housing, and so on and so forth. Now, can this rights consciousness be utilized to improve the living conditions, the education, the healthcare, housing conditions, your petty production and agriculture, small-scale industries, service deliveries, and so on? Because the dominant paradigm, development paradigm has shifted by 1990s, as saying that now new challenges in education, the fiscal crisis of state, you cannot address them by the public education cannot address it. Therefore, there has to be privatization of education, privatization of healthcare, and so on. See, undermining this whole social infrastructure that has been historically created in Kerala. So how do you address that? So it was thought, all right, following the principle of subsidiarity, you devolve down, say about 1/3 of the development funds of the government, untied to the local governments. Now the people are conscious of the right, they will make demand. So give them the power, the funds and functionaries to transform their demands into local level action, to provide for their basic needs. This was the whole idea. And this has worked so fantastically. Now, there are a lot of problems, but nevertheless, looking back 25 years, you find, for example, healthcare, the percentage of population using public health has increased from 38% to 48%. The infant mortality rate has declined from 15 to 7, mind you. Public education, 500,000 students have shifted from unaided private sector into the public education system. And regarding the quality of index of education, Kerala has been ranked first by Niti Aayog. 2 million houses have been built by the local governments mostly. So much so, another 500,000 Kerala would have resolved the housing question. And every houses now have latrines as well as electricity. Okay, Manida spoke about neighborhood groups, women neighborhood groups. Do you know the microfinance system now provide micro loans of 11,000 crores of rupees. That's a huge money access with interest subvention. And poverty ultimately is the fastest reduction of poverty in India. Okay, so all that I want to say is Vanida is right in identifying as decentralization as the best thing that would have happened in Kerala in the last quarter of a century. Now, how does this rights-based development and democratic decentralization in Kerala help to address the COVID challenges? Now, this is not something that is undertaken by the local governments alone. There is local government, there is state government, and of course central government. So people will make demand. COVID doesn't mean that you can put us somewhere. The healthcare has to be provided, food has to be provided. So education has to go on. There are tremendous demand on the government, and therefore there are certain things that government has got to do. With the help of the local government, this is translated into local level actions. I don't want to repeat all that has been done.
I'm sorry,
Only
Mr. Isaac, sorry to interrupt, but in the interest of time and also answering some of the other questions, can you please also share with us where do the resources come from? One of the initial questions we had asked if it was progressive taxes at state level or something else, because definitely the pressures of the pandemic must have mean we need to get more resources.
I think there are two. Okay, first one. It's a subnational government. Therefore, it is subject to hard budget constraints. For example, Kerala cannot print money. Kerala cannot go on borrowing as it wants. It needs to abide by what center says. So for what we have done is, whatever annual borrowing that has been permitted, we front-loaded them and borrowed it outright in the beginning of the financial year. And because we knew unless you provide people with minimum basic support systems, you are not going to get the compliance, which is very, very important to address the COVID, the social unity, cohesion that can be achieved only when you have that people's needs are met. Therefore, just a big risk. Your government can break down halfway through because you won't have money left. But that's different. That's a challenge politically to be met. And therefore, we front-loaded our borrowing, borrowed and transfer money. In fact, the day the lockdown was declared, we declared a package of 20,000 crores rupees. That's a huge money for a state government to do. So that's how we primarily. Second, we have our financial institution, parastatal financial institutions with our cooperatives, our state financial enterprises and corporation and so on. So we have utilized them to extend additional loans, consumption and otherwise. For example, we provided 2,000 crores of consumption loans to people at industry and so on. For now, laptop is made available to everybody to participate in online classes. They get upfront. They have to repay only without interest over 3 years. So we have utilized our financial institutions. And thirdly, importantly, you asked about Vietnam. I think one thing common with Vietnam and Kerala is that they have used relatively, what to say, it would be wrong to say cheaper, but cost-effective methods of meeting the COVID challenge, which focus much upon social response. That simple things of wearing masks, sanitizing your hands, and keeping the physical distance. We don't say social distancing, we call it physical distancing and social unity. That's the slogan of Kerala. So, see, there it is not the money that matters. It is how well the society responds. The money is, you are going to spend money in providing them food, first-line COVID centers, and so on and so forth. But real success is out of that. It's not just a health response, a social response. People now actively participate. A trust is created, public trust in the government. That's very, very important. Only criticism that I would have with Vanida is, if I were you or Vanida, I would have spoken the same way. But you are not Kerala minister, you are outside, you can be more critical of Kerala. You know much more about Kerala than you said. Critical, there are many things not so good. It's a very stylized presentation. I think it brings home, I think, a very important aspect of the Kerala experience.
Thank you so much.
Thank you, thank you. Thank you, Isaac.
And we had two discussants from Don, Corina Rodriguez and Kumi, who are there waiting to be called, because I had some questions to make some sort of comparison with with other countries. But on the interest of time and answering more questions from the audience, I will deeply apologize to Kumi and Karina. And perhaps I will go directly to you, Vanita, in asking you to respond to some of these questions. One of them, I mean, there are a few comments made by Asha in relation to the challenge that I think that throughout the conversation, many of the challenges, and also Mr. Isaac mentioned some of them. But there is a very concrete question by Ana Maria Bejar. She's Director of Advocacy at International Planned Parenthood Federation. And she wanted to ask, what do feminists and transgender activists advocate for in Kerala right now? The other one is Avanti Mukherjee. I think you know this person. Avanti asks, Kerala has a long history of social movements, as Dr. Isaac pointed out. Her question is, how has civil society more generally and women's movement more specifically featured during the COVID-19? Is it really all the state?
I think for me, I think one of the feminists on this call should come in. Maybe Eliama or Nalini or someone, but I'm happy to answer about the transgenders. So the transgenders have emerged, you know, because in 2015 itself, Kerala started a process of including transgenders. So, and also there are quite a few groups of transgenders in Kerala. There are only 25,000, but it's a very, very visible group. And one of the critiques within the transgender by the trans men is that the women are more visible. The women are part of these neighborhood groups. The women get they're part of this, you know, they become a part of this whole women's neighborhood group movement. And they run canteens. I mean, there's lots of, see, one thing is to promote their livelihoods, but also their rights in terms of, you know, sex change. And I think one of the things they're advocating for is to have more hospitals that will facilitate the sex change and reconstruction surgery. I think right now they're just one or two. They do not have enough trained doctors in Kerala to do it. They have to go to Bombay, and you know that one big hospital is a private hospital. So what the state has done is to compensate with money, giving them 100,000 rupees, which is what? I mean, I can't now, it's like more than $1,500 maybe, as a kind of a token thing for whatever they spend on in the private thing. So that I think is a very, very big demand from them, and that's what they're advocating for. The other thing is their identity cards. So, I mean, and this is the fascinating thing again. Sorry, I'm so all the time talking good things about Kerala, but it is what it is. So one of the things was that, you see, it's a self-identified gender that they are entitled to in their cards. Now, in India, you see, whenever a law or a policy is implemented, for them to particulate it down to the clerk in the offices who do it takes a lot of time. So there was a very, very dynamic young activist who moved the court in Kerala and won the case, and saying that, you know, this has to be done in a particular way. And so now that has been streamlined. So I think in Dawn, we always talk about right as a tool and an instrument, and that there are norms and standards. And we can always use this tool to see that the norms and standards are followed. And I think that's exactly what has happened in Kerala, where they are looking at the policies on all their rights, and it's quite a comprehensive thing. And Sonia Korea, I will share these documents with you. One by one, they're really ensuring that the state is responding and actually implementing. It is a process because it's about 5 years old, and the best part is that they are part of these gender cells at the local level. They were part of the policy making. So they're very much involved in the whole process. So that is the advocacy. I think on the feminist, I would please defer it to any one of you, Nalini, Eliama, and whoever is here, Meera, why don't you just tell in the chat and we can put you on.
In the meantime, Vanita, perhaps we can go back to Kumi and ask a concrete question. I think it's interesting to bring up the similarities to other populations. I know, again, that Kerala is not a state, but Kumi, if you could just join in for a second. Yeah, so I wanted to ask you, Kumi, Sri Lanka has similar social indicators and trajectories in terms of social development in relation to health and education since the 70s, similar to Kerala, I mean. And both have strong public health systems in place. So what are the similarities, differences that you see with Kerala in how the pandemic has been handled?
Well, actually, MG, we do have very good public health indicators and indicators for the quality of life, similar to Kerala, maybe even better than Kerala. And we have a population that's smaller than Kerala at 22 million. Looking at the pandemic, interestingly, our infections to date are about 2,800, with 2,300 or so recoveries and 11 deaths. But the question for us is actually the issue of testing. If the question is, are these numbers correct? Because the pandemic is being handled mostly by presidential task forces, and the particular response, the direct response to the pandemic is actually under the guidance of the command of the armed forces. So the health system certainly kicked in. Whether these figures are really correct or not, we don't know. But I think a lot of the surround support that Manita was talking about was not available in Sri Lanka because we were not allowed to give that support. So the decentralized panchayat-like systems, the local councils, the cooperative societies, civil society itself, was actually not allowed to move into looking at how to support communities. Although we did have cash transfers quite similar to Kerala, and we tried to mitigate some of the impact, particularly of the lockdown, the economic impact. One of the things that, because I worked with low-income communities in Colombo, one of the things that struck me was the levels women started talking to us about compromised nutrition, for example, how they had to eat last, eat the least, how they couldn't afford, particularly from poor income families, they couldn't afford provisions, basic needs, and so forth. And that support, the state hasn't really been able to give nor continue with. And of course, our lockdown now has been lifted completely. We are in the process of election campaigning. And the thing that's so different from Kerala, although we have an extremely good health system, was that Parliament was prorogued in March, and the response to the pandemic was not through line ministries. It was through presidential task forces that had the military, that had religious personalities, that a whole range of people, and hardly any health professionals. So that was one issue. But I really want to talk a little bit about the question of resources, because even for us, health sector expenditure, we have a very good public health system, and we need to keep that level of expenditure up. But we don't now have the money because foreign exchange remittances through migrant labor, which is the chief foreign exchange earner for the country, has dropped significantly. Exchange earnings from tourism, from export processing, and so forth. So the country really doesn't have the money. And thinking of the transition from the pandemic, I think we need to be very conscious of this, because if state support is required, and state support will be required, particularly for low income, for middle income groups, people who will lose their jobs, how are states going to deal with that? You know, that I think that's a critical concern here. I'm sure it will be a concern in Kerala as well. So these good indicators, given that, the pandemic can resurge, you will continue to need this support, but the economic crisis will also have to be dealt with. And for us, much of our population, our working population, is in the informal sector, 60% of it. Many of them are women. And all they can, the only vision for women's employment has been small and medium scale employment or microfinance. And that's put women into debt and the repayment of those debts. That all of this, I think, needs to be rethought. So there's lots of issues, given that health in itself is also dependent on a range of other inclusive rights. That's very quickly what I want to flag. Yeah, did you hear me?
Thank you. I was muted and couldn't unmute myself.
Just one other issue I want to quickly raise is the question of my external migrant workers and who should be responsible for the fact that these migrant workers have absolutely no rights, are completely expendable, that receiving countries are taking no responsibility for them. And when they come back home, either to Kerala or to Sri Lanka or to all the sending countries, what do we have in terms of a response to dealing with an influx of unemployed migrant workers into our countries now? That's another issue.
I think Kerala had, on that migrant work, I mean, I have read a little bit, but I think there's a whole effort to see how they can build the skills of the returning migrants and see, like Kerala has this whole army of nurses who have a reputation all over the world. So they are doing something like, teaching them Spanish, teaching them different languages, looking at countries who would need these nurses so that, once they've left the Gulf and they do not have an opportunity, they can now explore new shores. So that is one of the things I know that Kerala, actually Mridul Eapen is online and she's a part of the planning board. And she had some ideas on this particular issue, Maria Graciela. So I don't know if we have time for her to come and talk about it.
Perhaps she can come very quickly, 2 minutes, and then we come back to you, Vanita, for some concluding remarks and perhaps to address some of the other unanswered comments and questions. So if the comms team could please allow Mridul to come in.
Mridul, M-R-I-D-U-L. Mridul?
Yes, she's with us. You can unmute and go ahead. Or perhaps the comms team needs to unmute.
So Mridul, can you comment on, the overseas migrants coming back to Kerala and what are Kerala's plans about really enabling them to access jobs, helping them? I think that was one of the questions from Sri Lanka, my colleague from Sri Lanka, Kumi Samuel.
Can you hear me?
Yes, yes, very clearly.
Yeah, no, for me, of course, the returned migrants is one big set of people we are very concerned about. But for me, at the moment, it's employment, how to give women and men work. Not, it's just not concerned with returned migrants, but for me now, the most important thing that the government has to do is to front load, like we did other things, now to front load work for the people, because it's the worst off who've actually lost work, the casual workers and the self-employed. Now, what about the returned migrants? Now, one thing that is also evident about them, that this time it's not the unskilled people who are coming back, it's actually quite skilled people. You mentioned the nurses, but there are also engineers and technicians and all, they're also returning. So there's a whole, there's a whole department which looks after the returned migrants called NORCA. the non-residents Keralites are being looked after. So they are planning how to actually engage them on all the new activities that are coming up in the state in terms of employment generation. There's a big agriculture convergence program called Subhiksha. There is going to be a very big program, pushing up small industries or big industries related with health and other related aspects of the COVID, whether it's making PPEs, whether it's making masks or diagnostic labs or anything to do with health. There's a big program coming up on that. So how do we involve all these people in that? This is the sort of thinking that is going on. And for me, the most important thing actually at the moment is to create, that's the most important, to create work for people, whether it's domestic workers, whether it's return migrants, whether it's the casual workers, whether it's the self-employed women at home. For me, that is now the foremost thing in my mind, and especially women, who are the worst off in the thing. But the return migrants, the NORCA is doing a lot of work in how to be able to place them once they are back home.
Yeah. Thank you, Mridul. That was very helpful to know. Can we ask Nalini to come online and speak about the women's movement in Kerala and their role?
Nalini, are you with us? Can you please just confirm on the chat if you can come in quickly to
I think Eliama has joined through Facebook. So Nalini must be here. Nalini, are you there? Can you please type a message to let us know?
She's on, but we can hear you, Nalini. Can you try speaking?
Ask Taz to put her on.
She's on, she's on. We just don't get any audio from her. I'm not sure if she has a mic set up.
Nalini. No?
I'm not sure.
No audio or video.
Yeah, no audio or video, and if you could then put something on the chat box just for us to know if you are available or hearing us.
Okay, what about Meera? Oh, Nalini has come on. Okay, great. Nalini? Nalini, we are waiting. Meera. Okay, I don't think Nalini has her system set up for this.
Yeah.
So Meera, are you there? Meera Velayudhan, can you please come on and speak about the women's movement? But Nalini, we can't hear at all.
Nalini was hearing us, and she said that she couldn't join in to speak. So maybe Meera, it's on a similar position.
Yeah, I think we are just waiting for one of them to come on. Eliama is on Facebook. Can she come on from Facebook to speak? Because she couldn't join the Zoom.
No,
the problem is she can't come online, on Zoom. No. So the problem with Eliama is that she can't come because she's on Facebook. She's joined the Facebook. Meera. What about Meera? I think that question is going to remain unanswered on the women's movement. I don't know if anyone, Mridul, do you know anything about the women's movement? Meera? But she can't.
Can you try speaking, Mira? We hear some noise coming from you, but not sure if it's working.
Yeah. So anyway, I think.
Yeah, I'm sorry that it's not working out with our guest, Vanita, but because we are reaching the end point of the webinar, can I please ask you to give us some concluding remarks based on the comments, the questions, or whatever else you were left to say?
Yeah, I must say there are so many questions.
Yeah, but
yeah.
And just before, because we're ending with that, I want to thank everyone that has stayed till now and that been participating, including our guests that joined spontaneously, especially the Minister of Finance. Thank you for your answers, and Ridul. And also thank you to our comms team that has given us so much support to have this talk today. So nothing else from me, just thanks to everyone. And Vanita, please go ahead and give us some final.
Yeah, so I think one of the, I just want to raise one point on Kerala, which struck me is the rights of the duty bearers in terms of, for example, the Kudumbashree women. They are right holders, but they're also duty bearers. You have the Ashas and the Anganwadis workers. These are the frontline women. They're duty bearers, but they're also right holders. And how do you reconcile this? And their rights to rest, their rights to, actually have some way of, because, these are women who are working at home, they must be getting up at 3, cooking, coming for this. I mean, they're all very enthusiastic. But I think this is one niggling question that we really need to deal with. And especially in the context of Kerala, where, they are working like for many, many hours and working very happily. But I think this is the whole unfinished question and a very difficult one. Because, yeah, there are volunteers, but, the young volunteers are something else, but these are women running households. And we really need to think about that a little deeply, about the rights of duty bearers like the frontline women workers. And yeah, and also that I think the other thing that struck me is that people are used to such a high standard of getting what they want, is that even during these times, there have been protests if they felt something falling short. Okay, and that is really something that was extremely heartening, and things get sorted out very quickly. So there was some issue in the coastal areas that got sorted out. So everywhere there are these issues that emerge, and for me, I think we really need to watch over the next few weeks and months about how Kerala really handles the community transmission. How does the private sector actually begin to respond? What is the model that the Kerala would actually have with the private health sector? Which would be very interesting questions to follow up. And I think I'll conclude with that. Thank you very much, everyone, for being here, all my friends. It is so wonderful to have friends from Kerala, and I especially want to thank them. I want to thank all the others who are here, all my other friends, my feminist sisters who all joined in from all over the world and from India. Thank you again. And I think after a break, the Dawn Talks would continue.
Thank you, Vanu, and everyone else, and have a good night, good evening, good afternoon, and good rest of the day.
Yeah, and I think I'm so glad that the hurricane didn't land in your island.
It just started 10 minutes ago. I keep looking through the window.
Okay. So the rain gods are with us. And even it didn't rain in Delhi, there's a threat of electricity supply being cut. So yeah, so good night everyone from me, and thank you again.